Welcome back, everyone. We're talking about prescriptions used to help people with addiction stay clean. But advocates say these legal drugs are leading to some families being separated. In tonight's Prime Focus, Eva Pilgrim looks into a practice known as test and report and how one mother is working to change the law.
When Nicole Costin and her partner found out they were expecting, they couldn't have been happier. She says she had been in recovery from opioid addiction for over a decade. She became addicted after she was prescribed pain medication for a surgery.
You know, I was going down a really dark road of using and abusing my medication. So I was introduced to Suboxone by my primary care doctor. It probably saved my life.
Suboxone is an FDA-approved medication for opioid use disorder, a class of drugs also known as MOUDs. They help people stop using. Nicole says the medication helped her take back control of her life. She had her first son and enrolled in school again. During her second pregnancy, her doctor switched her to a similar medication called Subutex. When her water broke, Nicole and her partner went to Glens Falls Hospital in New York. She says she told the staff she was on an MOUD.
They then proceeded to take a urine from me, which wasn't out of the ordinary.
Nicole says she overheard a nurse say they were still waiting for the results of a urine drug test.
I was upset that nobody informed me that they were doing that, but I didn't have any reason to be concerned about it.
But that didn't last long. Soon afterwards, she says a staff member came into her room.
I'm here to inform you, you failed your test for cocaine and PCP. And I was in shock. That's impossible. You have the wrong urine, go check again. You have my blood, go test my blood.
Experts say Subutex wouldn't have shown up on a drug test as PCP, cocaine, or even an opioid.
Somebody please explain this to me. The doctor, he had said to me, well, we test people who come in here on Suboxone and Subutex every time. The joy that I had when I got to the hospital was gone.
Nicole says that shortly after her son was born, the staff took him away to collect his urine and test it for drugs.
You know, in this moment, I'm like, what? You know, no, you can't do that. Please don't do that. They didn't ask for my consent, nor did they explain it to me. They just did it.
Nicole is suing the hospital, alleging medical malpractice and that after she disclosed her use of an MOUD, she was denied equal treatment in violation of the Americans with Disabilities Act. Her lawyers say that if her discrimination claim is successful, Nicole's case could serve as a model for others with similar experiences. The lawsuit alleges that the hospital knowingly reported false positives to Child Protective Services, despite having a second drug test come back negative. When CPS showed up, they made Nicole take a third drug test, according to the lawsuit, before she and her baby were allowed to leave the hospital.
Child Protective Services was at our house moments after we walked inside. She wanted to talk to my son. She asked him intrusive, invasive questions.
According to the lawsuit, CPS closed the case. A Glens Falls hospital spokesperson told ABC News they cannot offer any additional comment on pending litigation. But in a court filing, the hospital denies many of Nicole's assertions and deny any wrongdoing. Nicole's allegations are not isolated. ABC News spoke with over 30 experts across the country, from lawyers to doctors, social workers, and women who have experienced what is commonly known as test and report. They described a widespread practice of healthcare workers testing the urine of pregnant women and their newborns for substances without their consent. If the test comes back positive, they're often reported to Child Protective Services. Federal law requires states to report the number of substance-affected newborns to the government and provide those newborns with a plan of safe care.
They do not require that Child Protective Services become involved in any instance of substance-affected newborns or a positive drug test result.
It's up to states to make their own laws about pregnancy and substance use. New York doesn't require testing and reporting. Only 4 states require it for mothers or their newborns in certain circumstances. In most states, the decision to test is made by hospitals and their workers.
Some hospitals have no policy at all. Some hospitals will require drug testing for all pregnant patients who come through their doors.
ABC News obtained data from New York State through a Freedom of Information request. It shows there have been nearly 10,000 reports of substance-affected infants to Child Protective Services since 2019. Numbers show an overall decrease in reports involving MOUDs, but there have been 272 during that same time period. Medical professionals consistently submitted the second highest number of reports, nearly 3,000. The data does not show how many of those reports are the result of non-consensual drug testing. Mount Sinai's Bridge program treats pregnant and postpartum patients with substance use disorder. Dr. Leah Habersham is the OBGYN and addiction specialist who runs it. She studies disparities in who hospital workers choose to test for substances.
When they were testing women and just picking and choosing who they would test, there was a lot of bias in that, and that they were oftentimes testing women because they were, maybe a minority, Black, Hispanic, or of a certain socioeconomic class.
Are they allowed to test women without their knowledge?
Using a toxicology test or a drug test should not be done without a woman's consent.
What happens to the baby if Child Protective Services is called?
Oftentimes they are separated.
I imagine there are a lot of these providers, the doctors and nurses, they're doing what they think is best, right? They're coming at it with this idea of protecting the mom and the baby. They want to make sure the baby's okay. What would you say to them?
When I was just a generalist, I didn't know what to do if I got a positive test, And I think it's very common that's the feeling of many physicians, because it's just not something that we're taught about.
After realizing the discrepancies involved in discretionary testing, Mount Sinai changed its policy to asking women a series of questions to screen for substance use and refer them to treatment if needed. Dr. Habersham's research found that there was no significant racial disparity after the change. But Mount Sinai is just one hospital system. There are ongoing efforts in several states, including New York, to challenge the legality of non-consensual drug testing and to pass laws requiring informed consent.
It is really critical that New York State pass legislation to strengthen protections for pregnant people.
Last year, a bill requiring informed consent before drug testing pregnant women and their newborns failed to pass in New York. Lawmakers who didn't support the bill argued it would put too many restrictions on healthcare workers. The bill has been reintroduced in the current legislative session. As for Nicole, she says she is still recovering from her experience.
What I went through was torture, and I never want anybody to feel the way that we felt in that hospital. There needs to be accountability.